Hi, I am Gina Assaf, co-founder and co-lead of the Patient-Led Research Collaborative, PLRC. I co-authored the paper I am presenting today on reinfections and joined by Leticia Soares, co-lead on PLRC and lead scientist on this study. PLRC is a group of 50 long COVID and associated illnesses such as ME/CFS and POTS patients who are also researchers. We were the first to conduct research on long COVID in April of 2020 and have published over 28 papers with 1,000+ citations. We are all researchers in relevant fields: biomedical research, participatory research, neuroscience, public policy, machine learning, and health activism, in addition to having intimate knowledge of COVID-19. Our work has informed many long COVID guidelines, policies, and studies. We have conducted research on characterizing long COVID and other relevant timely research on long COVID. Over time, we saw that reinfections were becoming common. By the end of 2022, 65% of the US population was estimated to have had a reinfection. Our study examines how repeat infections impact health, particularly the risk of long COVID and symptoms like post-exertional malaise and fatigue. We developed a detailed Qualtrics online survey and included validated measures like the fatigue severity scale and DePaul symptom questionnaire for PEM. The slide here shows some survey screenshots that the participants went through. The survey covered demographics, then used a reinfection loop to repeat questions for each infection: medications, hospitalizations, and whether new or ongoing symptoms persisted for 3+ months, which was a key indicator for long COVID. Additionally, anybody who ever had long COVID was asked if they were experiencing health issues at the time of the survey. Finally, everyone, regardless of COVID status, reported symptoms like fatigue, PEM, immune dysfunction, and where applicable, menstrual health, and then symptoms associated with COVID and long COVID. We analyzed responses from 3,382 participants. Our respondents were primarily women aged 30 to 50, mostly from the US, but also from Europe, Brazil, and globally. Most respondents had one infection, a fourth had 2 infections, and 10% had 3 or more. More than half experienced long COVID, 21% had COVID without long COVID, and 22% had no COVID history. Now I'll pass it off to Leticia to go into the results of our study. Thank you.
So we asked respondents whether at the time of the survey they were experiencing health issues and symptoms related to previous COVID-19 infections. And we observed that relative to those with one COVID-19 infection, those with reinfections had higher odds of reporting long COVID, which is answering yes to this question. There was this 1.75-fold increase in the odds of reporting long COVID between those with 2 and those with 3 or more infections. And as observed in other studies, males were less likely to report long COVID than females. So we assessed fatigue using the fatigue severity scale. So we classified participants as fatigued or not fatigued. And we observed that having had COVID-19 at least once was strongly associated with the odds of experiencing fatigue. And the odds of fatigue were higher among reinfected participants, but we found no difference between those with 2 and those with 3 or more infections. And males were also less likely to experience fatigue, to be classified as fatigued, as in comparison to females. We assessed post-exertional malaise using the DePaul symptom questionnaire, the short form for PEM. And we found that the odds of experiencing post-exertional malaise were higher among reinfected participants, with no difference between those with 2 and those with 3 or more infections. Also, males were less likely to experience PM than females. We also presented participants with statements that would measure proxies of immune health. So we asked them to agree with statements. So, for example, I have had many other infections that are different than COVID, and it takes longer to recover from common infections than it used to. And we observed that the more COVID infections were reported by participants, the higher the odds of agreement with statements that were indicative of poor immune health. And we also found no difference between males and females in their probability of agreeing or strongly agreeing with these statements of immune health. We wanted to measure a proxy of disability, so we used the physical functioning subscale of the short form 6-dimension version 2 for quality of life. And the more COVID infections, the higher the odds of reporting limitations in physical functioning, most of the time or always. So limitations were, for example, limited in moderate activities, that they accomplished less than they would have liked. Social activities were limited, and that they were limited in bathing and dressing. And we also found a difference between males and females in the probability of responding, that they experience these limitations most of the time versus always, with females reporting higher probability of response associated with increased limitations in physical functioning. We found that COVID-19 increases the odds of reporting menstrual health symptoms. So as we can see in this graph, when we compare the column of no COVID versus the columns representing those who have had COVID-19 infections, we can see a clear difference there. And we also found that for specific, the sport-specific menstrual health symptoms, reinfections were associated with increased odds of reporting them relative to those with one infection. So heavy bleeding, bleeding with clots, abdominal pain during menstruation, and cramping were the symptoms that increased with reinfections. When looking at overall long COVID symptoms, we see that COVID-19 infections increase the frequency that the symptoms are reported, with an increase associated with reinfections. I don't want you to be concerned about reading each symptom label on the left, just observing the general pattern that reinfections were associated with increased odds of reporting long COVID symptoms. And in fact, 50 out of the 67 symptoms surveyed were more likely to be reported by participants who experienced a reinfection compared to those with one infection. So in general, COVID-19 reinfections were associated with increased odds of reporting long COVID. Participants with reinfections had higher odds of reporting fatigue, post-exertional malaise, mental health issues, and symptoms with long COVID, symptoms of long COVID. And reinfections were associated with increased limitation in physical functioning or disability. Our results underscore the impact of COVID-19 reinfections and the importance of taking reinfections into account to understand the clinical course and the pathophysiology of long COVID. And preventing COVID infections remains imperative to prevent long COVID and the worsening of outcomes associated with long COVID. Thanks for listening.